supporter. I'm Dr. Mohammed Shulchuddin, MSCOO7 version. Those are doctor and patient for them. First, I complete graduation from Holy Family Red Crescent Medical College. Eknong Iskarton Road, Mokbazar, Dhaka, Bangladesh. As far I know. Then my complete SSC, secondary school, secondary secondary school certificate from Dhaka Government Muslim High School, Lakshmipur, Lakshmi Bazar. My educational institution is class 1. From class 1, I not go to the kindergarten. I go to the first I go to the class 1, East Bengal Institution, Shodorghat. Then KL Jubilee School, KL Jubilee primary class, complete primary. In class 1, East Bengal Institution, and primary class I go to the KL Jubilee School. In high school, I go to the Dhaka Government Muslim High School. I complete SSC, higher school certificate, higher secondary certificate is higher secondary certificate is SSC, secondary school certificate. In case of my secondary school certificate complete from Dhaka Government Muslim High School, then that is Lakshmi Bazar, Lokhi Bazar. And in case of SSC higher secondary school certificate, inter course I complete from Kovinozuri School. In case of SSC, my mark was 4.06 grade in 5. In case of inter, my mark was 3.50. And I complete MBBS course from Holy Family Red Crescent Medical College. And I complete not regular, irregular course. I complete course in 5 years course equal more or less 10 years. My registration number, Dhaka Medical and Dental Council, my registration number 75,995. Dr. Mohammed Shulchuddin, still now unvalid. I not enough money to complete correct that, validity expire. So my friend supporter, how I give lecture, how I do doctory if my validity is expire. Still now my validity registration, you see that my Bangladesh Medical and Dental Council, Dr. Mohammed Shulchuddin, you check that 75,995. My validity expire. If I validity expire, I do give serve or provide service. Is it fair? Is it also corruption? But I have not enough money to complete that. Complete that to complete my my session validity, complete to clear that or correct that. Okay, fine, don't worry. I want my white money, then I do that. Nobody give that. Thank you very much. Now my friend supporter, medical science. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, database, calculation, with experiment. With experiment. Now I'm in case of my I am emergency medical officer of Fair Diagnostic Complex. That is Lower Pool, Fair Diagnostic Complex, and I remain in submodule 1 or 2 now. 1/3. Still now I in Fair Diagnostic Complex, Lower Pool. EMO, Emergency Medical Officer of Fair Diagnostic Complex. In case of my home, I remain 1/3 Moni Mohandas Lane, Bikrambolpur Bila, Sutapur, Dhaka, 1100, flat number 6. English, in case of English, 5th floor. In case of Bangla, 6 tala, 6 F3. If you say ground floor 1 floor, then that is 6th floor, F3 flat. Still now, if I change, then change. So what is medical science? But nobody disturb, please. Nobody disturb, except nobody disturb. I cordially request. And my mobile number is still now 01670795580. If necessary, then otherwise not disturb. My mobile number 01670795580. এখন now, what is medical science? Medical science, what is science? Science is anything, science is anything, any event, any problem, any occurrence can solve by logic, document, database, mathematical calculation, with proven, with experience. That is science. What is medical science? Medical science is the branch of science described, elaborated about creation like human. Scientific name of human, Homo sapiens. Described, elaborated about human process, disease, human normal physiological system, also disease process, also management of disease. How? What is the branch of medical science? Main branch, medicine, surgery, gynecology. Medicine, surgery, gynecology. So I remain in medicine. You know that medicine. Also I complete post-graduation training from Dhaka Medical College Hospital in medicine 6 months, in surgery casualty 6 months from Dhaka Medical College Hospital, 6 months post-graduation training. Okay, fine. PGT or post-graduation training. And now my friend supporter, medical science. If you know medical science, if you understand the medical science, why we say in medical science anyone die or born? If anyone born, how born? That described by embryology. On general, father-mother love. Father sperm go to the mother uterus and come mother uterus. There is come ovum, and mother uterus, sperm, ovum meet together or love together from a zygote. From zygote, you know that multiple cell division, mitosis cell division, and 1 to 2, 2 to 4, 2 to 4 to 8, 8 to 16, 16 to 32, 16 to 32, 32 to 64, 64 to 180, 128, 128 to 128 to 256, 256 to 512. Then in case of embryology, morula, blastocyst, then clotted blood, then germ layer, ectoderm, mesoderm, endoderm, then ovum-like structure, and from that fetus. Then when born, neonate, 0 to 29 days, 0 to equal more or less 30 days, neonate, then then infant, then child, then adolescent, then teenager, then young age, then middle age, then old age, then when time is over, game is over, die, death. So as a human in that age, equal more or less, what is the time? Equal more or less 100 years. But those that remain above 100 years, they are fortunate. And if they good, if they are good human, that is creator blessing. If they do bad work or not honest, not believe one and only creator, that is punishment. Because if you die, believe one and only creator, follow the rules and regulation of one and only creator, and die with Iman, you go to the heaven. Although we say die, but you go to the after death life, and creator judge you what she not what, and prize like heaven, special heaven, like that. Those are bad human, those are not good, not bad, they go to the place between heaven and hell. For example silver, for heaven for example gold, for special heaven for example diamond. And those are do bad work, they are punished by hell. Then creator forgive, if give right to live there, for example bronze, like that. So believe one and only creator, then follow the rules regulation of one and only creator. Why I say that? As a medical science, as a doctor, you also believe one and only creator and follow the rules regulation of one and only creator, that is necessary. As a Muslim, those are Muslim. What are the seven commandments? What not to do, then what to do. No bad word, do good work, by good. What I say that in case of do or die situation, if you know that do or die situation, one and only creator can help you or give clue you to correct the patient, or what is the diagnosis of patient. So for that by meditation also you know medical science, by medical science. So medical science, already medical science and embryology and born to death you know. Now you know that what is life. Life is a special type of energy content science. Presence of life, sense alive. Absence of life, sense die. Then you know that zygote cell, single cell to as per science equal more or less trillion cell human, adult human, not abnormality. Okay, fine. But I say equal more or less 18,000 color cell, and each and every cell has equal more or less same. Also special type of cell. How much special type of cell? For example RBC, non-nucleated. For example stem cell. For example other cell. For example like Langerhans cell, Kappa cell. Langerhans cell found in macrophage, go to the liver, we found, we say that Kappa cell, rather, you see the book. And Langerhans cell we found in macrophage, in TB phase. Macrophage, go to the, okay, thank you. Normally not present when TB or other disease occur, we found the Langerhans cell. Fine. Then in macrophage, in disease process. Now for the doctor, at the end of the disease, what happened? Cardiorespiratory failure. First, what is the reason how patient die? Develop shock. For the basis of dangerous neurogenic shock, what is the reason? Brain, how much time alive you need that nerve cell without oxygen. Then heart, then other organ, then body limb. Okay, fine. Then neurogenic shock, cardiogenic shock, septic shock. Septic shock depend on infectious agent like virus, bacteria. fungus, parasite, cardiogenic shock, neurogenic shock, cardiogenic shock, septic shock, then anaphylactic shock, allergen particle, then hypovolemic shock. If shock develop, sometime combination of shock, see the sign symptom of shock and give the hot shock is you diagnosis, give that treatment. And at the end of the process, every shock, cardiorespiratory failure. If cardiorespiratory failure, so if respiratory failure, see the oxygen vital sign. In vital sign, you see the oxygen saturation reduce. Give to oxygen. And if in adult, the respiratory rate go to the pulse rate go to the 40 to 20, you give atropine. If go to the below 30 or below 20, you give adrenaline. Also shock management. In case of neurogenic shock, you give the painkiller like pethidine, morphine. Not give IV. If nerve injury, not give IV. IM. IV may be risks. If chronic disease or other disease treatment, that is the reason neurogenic shock management, pethidine, morphine. And in case of cardiogenic shock, adrenaline, dopamine, adrenaline, fine. In case of septic shock, in case of bacteria, antibiotic, antiviral, in case of protozoa, antiprotozoal, in case of healthy immune, anti-healthy. Then anaphylactic shock. Anaphylactic shock is managed by antihistamine. Then hypoponic shock. Hypoponic shock you get a normal saline. That is the management. IV normal saline. And use that sometimes the if cell injuries, shock complication arise, cell injury is dangerous. You know that. No drug is not work. Then you should have chance to those are professors should have chance to give treatment with steroid. Although steroid have more side effect, but steroid more cell injury occur. You understand the more cell injury or more cell organ failure go to that case. You give the steroid. Steroid is the choice of drug, but steroid have more complication. And in case of steroid, you know that there is a more complication, and only professor should have right, and only doctor should have right to give steroid, not others. When necessary, steroid. What is the mechanism of steroid? If cell membrane destroy, membrane phospholysis enzyme. Steroid inhibit the membrane phospholysis enzyme. As per medical science, prevent the cell injury. So, how much cell injury occur? Like if cell injury occur like heart or nerve, brain or heart or vital organ like liver, kidney or other, then protection of cell injury, steroid will give. So thank you very much, my friend supporter. Today is enough from science, medical science class. If I do any mistake, see the main book. In case of main book medicine, I read 20th edition, Davidson, and in surgery Billion Lab. In gynae, I not read main book. I not women, so I read Dotto. Thank you very much, my friend supporter. Today is enough from science class. If you medical science class, if you have question, write down in my comment box. Thank you very much. Today is enough from medical science class.